Hi, I'm Dr. Alex Hodges. I'm a family nurse practitioner, a clinical professor at East Carolina University College of Nursing, and the assistant chair for the MSN programs in the Advanced Nursing Practice and Education Department.
I'm Dr. Michelle Skipper, and I'm also a family nurse practitioner and clinical professor in the College of Nursing and in charge of the Family, Adult Gerontology, and Healthcare Emergency Disaster Management Certificate programs. We're glad to be with you today to talk for just a few minutes about our roles in disaster management and emergency, and have sort of titled this conversation for Framework, Expecting the Unexpected. And just to give you a little background about ourselves and our work in this area and why that hopefully is intriguing to you today. For myself, I remember stories of hurricanes from the 50s and 60s. And as a young person, thought at that time, I'll never need to know about that. I'll never need to worry about those things. Those are great stories my elders are sharing. And then even when I began to work with ECU was after Hurricane Floyd, the folks here who had lived through Hurricane Floyd. And then in my own experience, very unexpectedly, being thrown into disaster management during Hurricanes Matthew and Florence when I was living down in Robeson County at the time. So that sort of spurred my interest in this work and helped us to really formalize some conversations and curriculum in the College of Nursing that we had long intended to do to help educate nurses to be better prepared for disaster management. Because it's not a matter anymore of if disaster or emergency comes, it's when.
Absolutely. And so I live on Hatteras Island, and I can remember when we moved there, I had lived in Eastern North Carolina, but like you, never thought about hurricanes touching my life. And Hurricane Emily was the first one. And I remember going to the meals and with the Salvation Army and volunteering and realizing this is part of life now. And didn't really quite realize the impact it was going to have on my career until subsequent hurricanes, like Hurricane Isabel, where I had to go to the grocery store via boat, and go see patients via boat, and it's one road in and one road out. So I quickly learned how to adapt, how to help my patients, and then took it a step further and actually partnered with AmeriCares and Harvard and created a toolkit that really has been instrumental in my work with climate health. Because we know climate health, it's not climate change. Yes, it's changing, but climate health is very important. And who would have thought hurricanes would hit the mountains or snow, a foot of snow on the Outer Banks this year? Who would have thought that? So it's impacting everyone.
And I think that's the message we want to share with folks listening to this is to be prepared and to spend as much time. We unfortunately in healthcare respond to emergencies very well in hospital settings and in the community for our patients and our communities, and unfortunately don't always do the best job preparing for our own selves and our own homes. And so both of us have, I think you would agree, have spent a lot of time in the preparation phase of that, trying to use a more standardized approach. Most of us, again, have gotten into disaster management work because we were involved in the disaster we didn't intend to be. But there actually are quite formalized programs, and FEMA and AmeriCares and so many other agencies use different standardized framework approaches to preparation, to mitigation, to response, recovery, all the phases of whatever the disaster is. Because like you just said, it could be snow, it could be hurricane, it could be tornado, it could be a man-made event, any of those. But again, if you have a toolkit, you have a framework of thinking through that disaster, you fill in the disaster, you fill in whatever it is, and then you figure out, okay, who has what roles in this kind of disaster? Because the scope and size of disasters is based on where they happen. A small storm in a small community may overwhelm a small community, or a small storm in a bigger community. So it's not the size of storm always. It's not the size of the event. It's what impact that event has on that particular community's resources.
Absolutely. And it cannot even be that it's a disaster. It could be that it's extreme heat, extreme cold, a wildfire. Again, living on the beach, you don't think of smoke and wildfires. Well, we get the smoke depending on the winds. And when you're seeing people in the community, how can they better protect themselves? Do they have an N95? Or do they have their inhaler? Are they making sure they are prepared? And I think the other thing that we both have really realized is this isn't just a nursing issue or a physician issue. It's the pharmacist, it's the dentist, it's EMS, it's police, it's fire. We all have to work together in our unique roles to help better prepare ourselves and our communities. But then also, how do we respond?
Right. And I would suggest step one in that is making sure our own homes are prepared. And I think we are speaking to a wider interprofessional audience. And again, healthcare folks are the best at running to a scene. They're the worst at having their own home prepared. And I think, climate health and things certainly are making these events more frequent. So again, that charge to us is to be ready for whatever may come. And then things that have changed really probably even since Hurricane Matthew and Florence in my life certainly has been how we respond to COVID in the midst of these kind of things. And, even adding another layer to shelter management, to, safety and strategy is, what do you do if there's a COVID outbreak or any other communicable disease?
Right.
And so do you have masks in your disaster bag? Do you have the things? And the other thing that's really changed is pet management. Folks typically these days will not go to a shelter that doesn't allow pets if they have a pet. And so again, thinking about, does your shelter have ability to do those kind of things so that people will come seek safety and shelter, or will they choose to shelter at home and understand risks? The other risk we manage a lot these days is what are risks to us as providers, and trying to share that information with the public that, like at Hatteras, when the wind is a certain miles per hour, you're not going to rescue people. Because we also have that inherent need to protect ourselves in disaster management. And we often want to be heroes, want to be renegades. But the truth of the matter is we have to protect our own selves before we can help anybody else.
Absolutely. And so things to think about for your at-home preparedness, no matter, again, whatever the time of year. And I'm always asked, so when do you start hurricane preparedness? It should be all year long. You should be able to be prepared at a moment's notice, because we've had storms in December that were categorized as a hurricane. So what do I do to prepare? I've got my pets' vaccination records so that if I go to a shelter or a hotel, I'm able to take them with me, because you're right, I'm not going to go anywhere I can't take my pets.
Right.
But do I have my medications? Do I have water? Do I have, bottled water? Yes. Do we fill bathtubs? That old adage, yes, we do, because I want to be able to flush the toilet or take a bath. You got to think about basic necessities. But what about our folks who maybe don't have transportation to get out? Are we reaching out through our church? Do we have, I'm sure you guys have a list probably of who calls who, like a phone tree. My church does.
Right.
So again, starting at home, what do you do to be prepared? And for me, like I said, it's my pets, it's my children. Do I have my vaccination records? Do we have for the pets? Do I have money, cash? Because credit card machines may not work, right? Or do you have gas? Do you have a generator?
Right.
So what about patients and specific medications? Is there something?
Right. And these days with insurance, it's hard to sometimes get an extra 7-day supply or a 30-day supply, but at least have your current meds and have your medications on a list. Because hopefully you're going to have a community pharmacist in a disaster that can help you with an emergency dispensing if that's required, and knowing what you can and can't live without is refrigerated. So again, if you're without electricity, what insulins do you have, or what other meds do you have? Does your nebulizer or your O2 tank, any of the durable medical equipment that you have, are those things bound to electricity or not? And how will you get somewhere? The other changing demographic in our state is the diversity of languages that people in our state speak. And so as we're getting information out about shelters and safety and when to evacuate places, I lived 100 miles inland during Matthew and Florence, and who would have thought about needing to do evacuations 100 miles inland, but making sure we're really thinking about vulnerable populations and knowing your community. I think that's probably one of my biggest takeaways is you may not feel called in your healthcare role or in your personal work to be in disaster management, but you could know your neighbors. And you could know your neighborhood a little better and think about, okay, I've seen my elderly neighbor who drags an oxygen tank to the mailbox every day. And is that person? And just be a good neighbor, to find out if folks really have what they need, or those with less resources and less availability and access to things and access to social media, access to any of that, might just need a little extra hand in a hard time.
Absolutely. And thinking about, you said you're great to write your list down of your medications, and folks will say, well, I've got it on my phone.
Right.
Well, your phone is going to go dead if you don't have electricity to back it up.
Exactly.
Or how many battery backups do you have? So those are very important things to think about. But then also, how do you communicate when cellular service goes down? So on Hatteras Island, I don't know about inland as much, but we have that one fiber optic, and when it's cut, it includes 911 communication. So we use our ham radio, and like you said, check on your neighbors. We literally will get on the ham radio and call to see, did you check this neighborhood? Did you check this neighborhood, et cetera? So you're right. Be proactive. Be mindful of who's around you when you're thinking when you're at the grocery store and you see that small family that doesn't have any support system. How are they going to manage in this scenario when they're barely managing day to day? Just reach out.
And then if you decide you want to increase your especially professional responsibilities in this area, every county has a board of health. Mm-hmm. And there's not a single county, I dare say, in our state, if you went to their health director and said, hey, I'd like to volunteer to be on your board of health, or I'd like to volunteer to review your county's disaster plan. Each county also should have some sort of list of their most vulnerable adults. And again, that might not be your professional role, but maybe even in a volunteer role during a time of crisis, you could say, I have 4-wheel drive truck. I have, a bike.
Absolutely.
I have those things. And friends, we're often, I think, in rural Eastern North Carolina, folks think we don't have things or we don't have access to things, but I would propose that we do have access to things, and maybe even better access to things, because again, if you know your neighbors and your neighbors work together in small communities, you already know who has what, and you already hopefully have trust built within those relationships, so that a neighbor who does have a boat, a neighbor who does have a tractor, a neighbor who does have chainsaws, will come together in a time of crisis to, again, help promote the best for their community.
Absolutely. And you brought up a great point. The health department is one of the most rewarding things that I have personally done, but also think about what else is in your community. Like we have the Hatteras Island CERT team, and they actually have funding that has satellites that are at our fire departments. Mm-hmm. So you can make phone calls or have communication. But another great resource is what volunteer activities are in your community. Is there a YMCA? There's usually a volunteer fire department, unless there's paid fire departments. Volunteer rescue. Even if you're not anything, you can get your EMT. And those particular areas really do come together in a crisis. No, am I a member of the fire department? No, but I'm looking at joining Women's Auxiliary so that I can help support those folks. So there's a place for everybody at the table. You just have to pull up the chair.
That's right. Very good. The last thing that I wanted to add some into this conversation about, again, is professional roles and licensing and responsibilities. Again, we hear often from folks that now in our litigious times, unfortunately, say, well, I'm a little afraid to know my neighbors. I'm a little afraid to help my neighbors. I'm a little afraid of what would be my roles and responsibilities as a nurse practitioner, physician, pharmacist, physical therapist, nurse. What are my liabilities, if you will, and what are my professional responsibilities in volunteering and these sort of things. And I would suggest to everybody to take time to look at your professional, your legislative board, your regulatory agencies to find out what that is. In our situation as nurse practitioners, there's a way that we can add a volunteer scope of practice that covers that. And then again, you may decide personally or professionally that you want to carry your own volunteer malpractice policy separately from your professional role, depending on what that might be. Those are very affordable in a way that make some people more comfortable with doing this sort of work. But the bottom line on this is that we still live in a state with good Samaritan laws. And so when your intent is good and you're not doing obvious harm to folks, then you still should be very well protected for trying to do the right thing.
Absolutely. And the other thing to think about is not everything requires a license.
Right.
So using the chainsaw and yes, you've got that inherent risk and you've got to make sure you are safe.
Right.
That is, paramount, but helping out in the community on, how do you clear the roads? How do you, do you wait for FEMA to come in? You do to some degree, but there's a lot that has to be done. You've got to get to access to water or electricity or to the Salvation Army when they drop they fly in and drop people in. So I think that's extremely important too to think about. And also thinking about wherever you work, what is your plan? We've talked about the at-home work plan, but there are plans to help you with at work. Like, again, the toolkit that I mentioned, we have things that administrators don't think about. Do you have a generator backup for your vaccines? Are you going to be able to provide care? Because that's one of the biggest things after a disaster. I don't know about you, but I can't tell you how many tetanus shots I've given. So that's something. People get injured, and just being careful and being mindful, and then educating the public too in those conversations when you're out and about. Post, you've done the pre now. We've talked about the pre, but how do we protect folks after the event? Not wading through the water that is probably septic water. Are there snakes? Are there, what are the hazards? Are there electrical lines that may be live and you've got water? So being careful and being mindful, but also being helpful to your neighbor, I think is one of the biggest things.
And working in some sort of coordinated system as best as you possibly can. One of the primary rules of formal disaster management is that there will be an incident commander. These days in our world, it's easy sometimes to skip authority or think we don't have to go through that, but it is best practice. It is absolutely best practice to have an established incident command, to be talking to that person. And if you're going to volunteer to help, to be willing to do whatever incident command tells you needs to be done. It might be that you're in your healthcare role, but it might be that they need you to go feed folks. It might be that they need you to help wash down the mats and the beds that were slept on in the shelter the night before. So if you're going to volunteer to help in this kind of work, you really are volunteering. And so sort of putting our own personal biases and power struggles, and I'm this and I'm that, and I have these titles and these roles. It's a matter of the common good and whatever folks at the higher level, if you will, not of authority necessarily, but who know the whole area. They have the whole picture of what's actually happening in the disaster and where resources are most needed at that time, instead of us trying to individually say, well, I'm going to go do this and I'm going to go do that. That's fine, but it just works a whole lot better, more efficiently, more safely to get the most resources to the most amount of people if we go through established chains of command. There are state DMAT teams, there are federal teams, there are all kind of, again, FEMA has dozens and dozens of modules for whatever sort of rescue and disaster you'd like to do. There are underwater trainings and dive trainings that you have in your area that I'm not going to have in my area. There are more agricultural, farm-based things, accidents with farm equipment, those kind of things that are going to be more common in my area than maybe at the beach. So again, think about what it is you want to do. What do you want to learn? And again, we can help. We'd be glad to share resources with folks, and I'll point you to folks that are already doing this work in your community.
Absolutely. And find out, if that is something that interests you. Great point. We're happy to help, but also talk to your community because they probably already have their disaster plan. No matter where it is, they're going to have a disaster plan. It just may not be, like, a great example is Asheville. Asheville never thought that they would need to use their disaster plan for a hurricane. They thought it would be a blizzard. So know your people.
And know the business and industry where you are. Again, thinking about vulnerability as a word, we think about vulnerable populations, we think about vulnerable people, but think about vulnerable businesses, if you will, who might have chemical storage, who might have other things that, again, in a disaster, that's going to trickle down to your water supply, your food supply, and how you're able to help manage floods. So many, many pieces, and don't get overwhelmed by the number of pieces there are to this. Again, find somebody who's doing this work and has done some of it, and even which of the phases of disaster recovery response you would like to get involved at. We can't do all of it. My gift is not to do the financial management part at the end of what did we spend and who spent it and who are we paying back for the things we borrowed. That is certainly not my gift. But you have to have those folks too that are charting and documenting and writing historical accounts of what happened, so that when it happens again, you take lessons learned. And I think that's one of the things I'm thankful for from Matthew to Florence in my area, is that people actually did better. We did better during Florence because of what we learned in Matthew.
Absolutely. And I think my big takeaway for everyone is to start at home. Make your toolkit, decide what you need. There's resources on the internet to help with that. We can help with that, because you have to help yourself before you can help others.
That's exactly right. It's the old airplane story. When you're boarding a flight, and they tell you to put your mask on first before you turn to help others. And sometimes that feels wrong to me, but then I know that it's right, because you can't help others without being safe and prepared yourself. So thank you for this. Yeah, thank you for this fun conversation today. It's fun for us. We hope it's been fun for those of you that are listening today. And again, our contact information, I think, will be associated with the podcast. And we're always glad to continue conversations.
Absolutely. Thank you so much.
Thank you very much.
Here's a website you can count on, whether you're a clinician, caregiver, or just curious. Medline Plus from the National Library of Medicine is your go-to for trusted ad-free health information. From conditions and medications to wellness and nutrition, it's all evidence-based and easy to understand. No ads, no hype, just facts. And best of all, it's free. No cost, no signups, no logins or passwords. Medline Plus works on a PC, an iPad, or a smartphone. Just visit this website, medlineplus.gov. Visit medlineplus.gov, your gateway to better health.